Good afternoon, ladies and gentlemen. Welcome to our side event. Thank you very much for joining us in this last moment. So we are really grateful that you are giving us time. I'm Tazin from Practical Action Bangladesh. We welcome you. So Bangladesh made commendable progress in sanitation during MDG era, but we need more pace of progress towards achieving SDG goal 6.2, that is safely managed sanitation. Bangladesh government has undertaken large-scale FSM and citywide inclusive sanitation projects, utilizing its own resources and receiving loans from international financial institutions. These collaboration efforts have led to notable achievements such as operationalization of around 35 FSTPs with an expected increase to 120 by 2025. But evidence show that existing FSTPs in Bangladesh are not operating at full capacity and are not financially sustainable. Today, we welcome you all to this side event titled, How Can Low-Income Countries Maximize Infrastructure Investments in FSM Service? And this side event is hosted by FSM Network in Bangladesh. FSM Network is a knowledge and advocacy platform for local and international NGOs to generate idea, influence policy and practice, and raise a collective voice to address sanitation challenges. Our side event today will focus on the impact of an infrastructure-centric approach to on-site sanitation system and how this approach may prevent us from accelerating towards safely managed sanitation. Discussion will address how to maximize the benefits of historical, ongoing, and future capital investment in fecal sludge management system. This event aims to facilitate learning and sharing from Bangladesh and offering valuable insights to other countries as well. The flow of our discussion will be, we would like to write an open letter to government, to donor, and also different banks about this investment, and we will be inviting your suggestions on that open letter, and then we will have a keynote presentation on this subject matter, and then afterwards we will talk with different experts through a panel discussion, and afterwards we will learn more about the FSM network, how we are operating in Bangladesh, and finally we wrap up. Now I would like to invite Mr. Uttam Kumar Saha, country representative, WSUP, for the next session. Thank you.
Okay. So I think good morning, good afternoon. Sorry. Yeah. I think you have received the one lab letter from the Fecal Sludge Management Network. Who have received this lab letter? Oh, I see still some colleagues have not received. Okay, so we'll pass it. Yeah. So what is this actually letter is? So letter is basically what our earlier colleague actually told, that in Bangladesh, the Bangladesh government has really taken seriously about dealing the fecal sludge management, and they have mobilized a number of good investment program. So already we have already a number of fecal sludge treatment plant in many cities, but almost from last 2 years and next 5 years, we are expecting there are already 1,500 million USD dollar has already confirmed that the Bangladesh government actually investing will borrowing loan from the development banks and also investing their own money and expecting that the fecal sludge management system, treatment plant and other logistics and other associated support program will be expanded into 175 cities. So this is good news because the fecal sludge management network member was continuously advocating the national government to mobilize more money, to put more money for dealing the fecal sludge management work. So, but there are some concern is still there. Yeah. So the money is there, the program is there, but if I talk about the operation and maintenance, so we think the fecal sludge management infrastructure and logistic in two different way. One is the infrastructure development. It's kind of the infrastructure developer. The other one is the system developer. So we from the network and especially we commissioned a study. The study result is yet to be formally published, but that study actually contracted 44 municipalities who already have the fecal sludge treatment plant in different capacity, and found this the 80%, 18% of the fecal sludge management is still unfunctional, as well as also the other issue. There are some other functional elements are there, but the optimum utilization of capacity that are not being used. So these are the two concerns. If the investment program is there, the infrastructure and logistics are there, but ultimately, if it is not properly utilized, then it will be a concern. So so that's why actually, and also this 18% I said that non-functional. So we commissioned a study to talk with the 44 municipality. But the functional part, there are some facilitating agencies are there who are mentoring the cities for quite a long time. So it's not only the infrastructure investment program. So I think this kind of mentoring capacity and coaching capacity is also very limited at the moment in Bangladesh. So all of a sudden, this huge infrastructure actually built, added in, but the supporting capacity are not expanded in that way. So that will be another risk for the Bangladesh. So that's why we have decided that from the network, we have decided to develop some of the key messages in terms of the support, putting more attention on the robust system for operation and maintenance. And the systems also need strengthening. So the system, these have different element in enforcing for the disconnection of the illegal drain connection to regulation for the municipal services. And we also need to consider why the fecal sludge are also not going to the treatment plant. Why all the infrastructure and logistics are there, but the fecal sludge are not going to the treatment plant, especially the financial flows that we need to understand very critically. So that's why, and in the new program, we are anticipating there will be a system strengthening component, but this will be very limited in terms of the budget and also in terms of the duration. This will be around 6 months to 2 years long program maximum. But we are quite sure the previous experience makes sure that this investment amount as well as also the duration will not work. So that's why we ask for increased and ongoing support for engagement of the professional system builders. So that is our main message, and these are actually written into the letter, open letter that we have already distributed to you. So at the moment, actually, we are expecting your comments as well as also suggestion that if the FSM network actually want to engage and draw the attention of the development banks So what will be your specific suggestion and comments? So that I'm requesting our colleague Claire to help us. She will give a Mentimeter and expect your suggestion. Yeah. Then number is also there and you can scan it. Yeah. If you put your comments and suggestion, that will be very helpful for the FSM network. Is it clear to all of you? Yeah. Yeah, we are expecting your comments and suggestions. Yeah. Yeah, I see. Yeah, a lot of responses are there. So emphasize on the economic value, of course. Take development bank staff to see the challenges firsthand. Very good suggestion. And the package system support with infrastructure hardware support. Very good suggestion. Ongoing capacity building support. Very good suggestion. Complementary grant program for soft system. Yes. Set aside funding for the operations and maintenance. Very good. Request that a minimum percentage spend on systems is included in all projects. Yeah, that kind of a condition or uh, kind of a binding condition. Create viable social enterprises that transport fecal sludge. That is the main challenge now, where actually we have to develop this kind of professional enterprises. System strengthening, yes, infrastructure, provide clear idea, yeah, how show the health risks decreases is about the showing the impact and the government and donor financing. Yeah, I think it's almost there. Is any other limit? Is it still working? Yeah. Yeah. Also,
Should be able to get.
yeah. 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 Provide the idea of what's the.
Maybe they're down. Is it down there, right?
Yeah. Yeah.
Where's it down?
Yeah.
Extremely. I can't actually see something. Yeah.
A great souvenir.
Yeah. Oh, sugar.
Yeah.
Okay, sorry guys.
Yeah.
I'm really sorry. That was terrible advice.
Yeah.
Did everyone have a chance to contribute though?
Yeah.
But we're going to record it anyhow, so we'll save it and we'll send it around as a PDF if that's okay.
Okay. No, thank you. So this was actually we were expecting your idea because build on this idea, the FSM network will set our next program, particularly for the engagement of the development banks. But please note, we are making sure that engagement of only the development bank is not the job of the fecal sludge management network. Fecal sludge management network is also doing other works that will give another presentation later. So I'm now requesting Tajinapa. I'm done. Yeah, thank you. Yeah.
Thank you very much, Uttamda, for sharing the love letter. And we hope that the donor and government will also encourage these suggestions. and the feedback that we have got from audience are really valuable, and we will definitely follow. So now we will have our keynote presentation on the topic of how can low-income countries maximize infrastructure investment in FSM services. We are requesting Dr. Tanvir Ahmed, Professor BUET and Director IT and BUET, to present this keynote. Thank you.
Thank you very much to be here in this side event again. So I think we already had a fair bit of discussion on the investments that are coming through. And I think the stage has already been set. So I had a few slides on those, but I'm going to skip those for the sake of time. So I'll restrict my talking points to, of course, give you some background on Bangladesh. So some of you who are not familiar with our initiatives, what we have done so far, I'm going to give you some background on how did we start this FSM journey and how we are planning to scale this up, what sort of challenges we faced, and what sort of options do we have to make all of this sustainable. Now, we are currently, according to the Joint Monitoring Program, we are currently at the level of 31% safely managed sanitation. And we are positioned in one of the countries which, according to the GLASS report, one of the countries which needs acceleration at a rapid scale. Now, how to accelerate that framework is already given by the SDG 6 Global Acceleration Framework. It basically says that we have to work on 5 fronts: capacity development, innovation, governance, financing, data, and information. Now, if we try to translate all of these into the sanitation business, we can get specific recommendations for each of those, but I'll come back to that later. The way we started our FSM journey, it was back in 2006, where the Asian Development Bank has undertaken what is called the Secondary Towns Water Supply Sanitation Sector Project. 14 fecal sludge treatment plants were constructed, mostly reed bed systems and various other systems. This was just the first experience of Bangladesh in small towns with a fecal sludge treatment plant. At that point, we actually didn't quite know what the fecal sludge management service chain, value chain actually meant, and a lot of things were actually unknown. But NGOs and INGOs played a very instrumental role through action research and demonstration of the value chain. And that was in 2011, there was a joint pilot by WaterAid and Practical Action. We got our first ever co-composting plant constructed by WaterAid, which was commissioned in 2014. And then we first saw how fecal sludge and solid waste can be combined to prepare co-compost and generate some sort of value out of the fecal sludge service chain. Then all the NGOs and INGOs, they started work very vigorously and through research, demonstration, and also some capacity building efforts. But then it got the government, we successfully did the advocacy. And the government actually has then found the appetite and its willingness to actually invest in some of these programs. So I think the NGOs played a very crucial role in Bangladesh during the period of 2006 to 2014, 14-15, and then government has kind of started to think about that this can be a potential solution for the fecal sludge management problem. But as Uttam already mentioned, that although we installed a few FSTPs, there were some challenges where some municipalities have been running the FSTPs successfully with the help of NGOs and their efforts, but some other municipalities, they were struggling because there were other things that they thought that they would happen automatically, but it didn't. For example, stopping of illegal connections to the drains. Not all households are accessible to fecal sludge management service. And there is lack of capacity and political will at the local level And these things were not very much because initially they thought that install an FSTP, it will run automatically, but that doesn't happen. So these were the learnings. And we see, although FSTP is constructed, they remain abundant. Some municipalities thought that it competed with other services, like the priorities, water, road construction, or drainage construction, or solid waste management. That's the priority. Financial aspects were not exactly considered, like whether or not we can generate some value from it. That was not considered. Whether or not the municipality organogram had an institutional capacity to handle an FSTP, that was not considered. And maybe there were delayed investments, and we could not use the sludge for any useful purpose. This was a outcome of the study that we did in Bangladesh in 3 municipalities. These 3 municipalities have been running FSTP for a very, very long time. But still, you see, they are running at most, the sludge vehicles are running almost 50% of their capacity, and the FSTP is running at only 1/4 of their capacity. And these are very matured municipalities, have been running FSTPs for a very long time, has NGO support. Despite that, it seems like they have not reached the full potential. And what if you can trace back the reasons is because of the poor demand. The municipality has not been successfully create the demand for fecal sludge management, even after such a long period of operation. Now, in the Bangladesh government in 2017 had then issued this institutional and regulatory framework for FSM. It's a document, basically, for the first time, it says that the roles of the sanitation stakeholders, like the local government institutions and the utilities, what sort of role do they have in the fecal sludge management chain, starting from collection, transportation, treatment to end-use disposal? Who does what? And this was first delineated in this document, and consequently, the National Action Plan was promulgated, which basically says that what do you have to do to achieve SDG 6.2, safely managed sanitation, by 2030, what sort of steps you need to do and the investments you need to make. That was kind of a rough calculation was done in these documents. Inspired by this document, so the country has the government has now taken massive fecal sludge management programs. We started with, so this is kind of the current operational and total set of FSTPs that we have right now. But by 2030, we'll have 100 plus FSTPs according to the government investment portfolio. And that is what Uttam has actually mentioned, that if these investments are all now lined up, we now foresee that by 2030, the construction will be complete. But after the construction, what is going to happen? So this is already mentioned that we are making almost $1.5 billion investments. In the meantime, around 2016, the approach of sanitation, how we look at sanitation, that has also changed. We have forgone the way of traditional way of looking at sanitation to a more inclusive sanitation approach. So sanitation approach is no longer construction of infrastructure. It's also, you have to provide equitable services. You have to consider the entire value chain. There has to be innovative technology. Resource recovery has to be considered, innovation, proper financing. Above all, you also have to focus on the leadership of the municipality. Overall, this is called the citywide inclusive sanitation approach. And this was an approach that was developed by BMGF and the development banks. And what they are actually saying, that you have to have some outcomes of equity, safety, sustainability, which has to be achieved through responsibility, accountability, and good resource planning and management. So sanitation cannot be seen as an infrastructure-only approach. Sanitation is now a combination of services. And those services all have to work very nicely and all together so that we can achieve these outcomes. Now, this framework has been adopted. Although we now know that in different small cities, some part by part activities of this CYS approach are already going on. For example, in Faridpur, with the help of practical action, they've shown how the fecal sludge service value chain can be done with the formation of sweepers cooperatives, which we already discussed in earlier sessions. In Jhinayda, with the help of SNV Netherlands, we have seen the operation of public toilets, data systems. And so these examples are already there, but these are only 2 cities. We need to implement the examples of these 2 cities, the successful example, to replicate it to all the 140 cities. That's the objective, and how to do that. There were also service delivery models available. In Faridpur, we see, I'm not going to go into deep into it, but just to show that municipality can earn revenue in different ways. They can contract the vacuum directly. They can own the vacuum and rent it out, as there is done in Kushtia and also in Rangpur. There are different revenue generation models, different service models that has been tried and tested. And in some places, more than others, it has seen to somewhat work. So these good examples are already there. Another thing, as a result of the institutional regulatory framework, that was the document that I mentioned, the government has formed a special cell, what they call the CWISE FSM support cell within the ministry. This separate cell basically guides the investments of sanitation within all organs of the ministry. So it does the advocacy within the government. It provides the support to implementing the FSM. So all these projects are now being channeled through this cell. And what the cell basically does, it just ensures that all the CWISE principles and the CWISE equity outcome, etc., these are all now aligned. All the investments are now aligned with the CWISE framework. So if we look at the CWISE ecosystem, we have the government stakeholders, the local government institutions at the top. We have the financial institutions providing us the money. We have a technical assistance hub, which provides technical us consultancy support, the Municipal Association of Bangladesh. We also have FSM network, civil society partners, the implementing partners who have created these wonderful examples, and IT and BUET as the capacity building partner. So there are some government initiatives centrally done, which has actually helping them to guide these investments. One of them is the National Sanitation Dashboard, which basically contains data of their solid waste and fecal sludge management, how it is going in each of the Purushabhas. Bangladesh has also constructed these sheet flow diagrams for at least 77 cities, which is available in the Suzana website. And these sheet flow diagrams are serving as vital information for doing feasibility for all these cities. So you want to invest on a city. Which city are you going to choose? You choose the city which has the worst scenario, needs some improvement. You look them up from the list, and you select your programs. And the application of IMIS has also been done. I think SNV can talk more about it, but this is also currently being piloted so that you can do this fecal sludge management in a more accountable way, so with the municipality. Now, I'm just going to give an example how projects are now currently being designed. So the 10 Towns Lives and Livelihood project, it includes 10 towns. It's an investment project which is currently ongoing. So when they are designing the projects through the CWISE FSM support cell and the planning wing of the DPHE, they are now considering that what activities we are going to do in the equity aspect, what activities we are going to do in the safety aspect and the sustainability aspect. And they allocate budget line items has been allocated for each of these activities, so that these are ensured. This is how the CWISE framework is now being implemented or being channelized through these development projects. So whatever project they now design, they will have these components has to be ensured. What aspects will they go? For example, in equity, you have to take care of the low-income communities, what sort of services they will have, safety as well as sustainability, development of business models, and these things has to be now ensured within the project. This was not done in the previous FSTP project. This is kind of the first CWISE project that we are going to have, and we're waiting to see what's this sort of mechanism, this sort of investment will result in. So CWISE framework is now adopted in all investments. Our objective is to see the role of DPHE gradually reduce and the role of municipality increase, because at the end of the day, the municipality is the one that is going to run the FSTPs and all the fecal sludge management services. So we have to capacitate the municipality. We have to make them own this thing and develop sustainability mechanism within them. So how they are planning to do that in the 10 Towns project is that the FSM Service Enterprise or Association of Informal Association of Workers that's going to be developed. They're going to purchase the vacutugs and will hand it down to the pit emptiers and entrepreneurs. They will work on the institutional arrangement, capacity building, development of business models, and they'll go into a tripartite agreement. So the way they are going to do it is in the first year, they're going to, DPHE is going to spend the money on the pit emptiers, try to do the capacity building, the training, all the support will be provided for the DPHE for the first year. In the second year, DPHE will expect that the municipality will start the earning from the Purosabhas, give them, so they're only going to give the technical support and hopefully that the entrepreneurs can earn the revenue. So they will try different business models and see which one works. They will teach them on contract management, capacity building, community awareness. All of these things will go side by side. This is kind of the current mode of execution, and they're planning to, they're trying to do a mix and match to see which one would be appropriate. Whether or not 1 year is sufficient or not, that's difficult to say right now. Maybe they need more time. But this is something that they are now going to exercise. In the capacity building program, we have previously people thought that capacity building was like, training, one-off training where you go bring some people, teach them FSM and then let them go. But we have identified that capacity building is required for various levels. The capacity building is required for decision makers, implementers, those who are working in the ground, the entrepreneurs, the private party who are engaged in, even the NGOs implementers, they also need capacity building. So we have a list of individuals we have identified a list of individuals and designed separate programs for each of them, may it be for the ministry officials or the engineers, town planners, or going down from the consultants on even the sanitation workers. They need capacity, and different modules have been developed. This is where IT and BUET comes in. I'm not going to mention the different modules, but this just to show you that different packages are now available for the 10 Towns LLF project, which they can readily use for capacity building, starting from the ministry officials all the way down to the sanitation workers. That's it. So how can we actually maximize the benefits for the SDG 6.2 acceleration? This is kind of the last slide in a sense. So we have to do capacity development. Capacity building is building on operation and maintenance, business model, sustainability of services, and building up local entrepreneurs. That should get priority. We should use innovative technology wherever it's possible, start doing the reuse and disposal so that we can generate some sort of value out of fecal sludge and solid waste management. We have to adopt a data-driven decision-making tool, because decision-making cannot be done arbitrarily. It has to be supported by data. And that data collection, information systems development for better monitoring, that has to be there. The financing has to be there because we optimize available financing, but we also have to try innovative business model as well. So there is scope of innovation there. Above all, we have to engage the local leaders, make SDG 6.2 their own business. That's very important because they cannot be left out and think that we're actually serving some other unconnected thing. This whole thing is connected and depends on the capacity of the local leaders who will make this sanitation their own thing. So just to summarize, this is the last slide. We have seen that FSM infrastructures can become non-functioning if sustainability issues are not addressed during planning. You cannot expect the FSTP infrastructure to automatically become sustainable. It has to be thought about from the very beginning and during the planning stage. We have experimented with various business models in different municipalities, but which one works for which municipality, it has to be context specific. Something that has worked for this municipality might not work for the other one. We have to do a mix and match and find out which one works. But the bottom line is there has to be a business model which will create the incentive to keep this running. And we have to adopt the CWISE framework for the investments, because that is how you can get the maximum benefit out of it, because that's the way you have good outcomes on equity indicators, you have good outcomes on safety, sustainability. Those need to be ensured. The LGI's leadership that we're talking about, the municipality, and the willingness to tackle the sanitation challenge is going to be very, very crucial, and I underscore this importance. So thank you very much. I'll be happy to answer any questions. We have some time for Q&A, right?
One question. There is about private sector investment. So what do you think? Do you think private sector investment is very much important to make it sustainable?
Private sector engagement is very much required, but thing is, in Bangladesh, there are not many private sectors entrepreneurs develop. So you have to develop the entrepreneurs first. So get people to start a sanitation business which they would be able to run. That sensitization is required from the very beginning, and I think DPHE will spend the first year in trying to engage or encourage people to come into the sanitation business, showing that, with the hope that this is going to be profitable. We need more businessmen who would take on this role.
And just bringing this so that if anyone is online, they can also hear the discussion. So.
Thank you, Dr. Tanvir. I'm just as a relatively newcomer to the sanitation space here, so I got 2 points that I was curious about. I see that you mentioned DPHEs eventually will be slowly phasing out with more handover of the operational role. So where do you see DPHE then? Will they be stepping into the regulatory role, or is there someone else that's going to be earmarked to sort of doing the regulatory process?
That's an interesting question. Regulatory process is still under development. I'm not sure that even at the municipality level, the regulatory activities will be done in the first phase. The big utilities will be the target for the regulatory mechanism in the first phase, I think. But there is scope for DPHE to become a regulator. The way currently it is set up, it is possible that DPHE can become a regulator only for the municipalities, but not for others. So we have to understand the role of DPHE. DPHE is not a service providing agency. DPHE is a technical agency. They will do the construction for you, give you handholding support, develop your capacity, teach you a few things on how to run this thing, but then they're going to go away and transfer this asset to the municipality, and then the municipality has to run it in the long run. So whatever technical support, other things, that is DPHE is going to provide. That's the way the sanitation institutional framework is set up in Bangladesh. So, but there is possibility and there is scope that DPHE can become a regulator for the municipalities.
Thank you. I had to pop out for a second, so you may have answered this question in your slides, but it's related to the Mentimeter question that we had about the role of development banks. So do you think that development banks are going forwards, having learned what's been learned in Bangladesh in the last 20 years, do you think development banks are particularly well suited to supporting certain points along the sanitation value chain and not others? I'm particularly thinking of treatment, which is CapEx heavy, which development banks traditionally are better suited to supporting. So do you see them as having more of a role funding treatment rather than emptying and transport services going forwards?
Well, the development banks have already, if you know that in 2016, with BMGF, along with the development banks, they have come to an agreement that for sanitation investments, they are going to adopt the CWISE framework. So, and this is not a BMGF thing. This is a development bank initiative. So wherever, not in Bangladesh also, but also in any LMIC or anywhere, any development bank is undertaking any sanitation investment, it has to follow the CWISE framework, and that's their internal arrangement. And if we see CWISE projects being developed by development banks, it will look like that. So it will have equity component. It will also have the transportation and other things component. They'll do the infrastructure, but they'll also have a big obligation that the whole system is accountable and responsible. And that points out to having big capacity building components inside it. This was in previous sanitation investment projects, this was like kind of a, offshoot thing. I mean, you develop the infrastructure, maybe 1 or 2 training and then done. But this mode of operation of investment says that it cannot happen in that way. You have to have strong capacity building components in all the FSM along every aspects of the FSM value chain. Even what are you going to do with the sludge? Are you going to reuse it, generate value? Are you going to use a business model? They have stake in everything now because of this CWISE framework adoption.
I just wanted to know about the regulation itself, because today we were talking about the soft components actually. So I think one of the way to make our FSM more sustainable is actually having a good regulations and a good awareness generation, because you were also saying that most of the FSTPs which has already been constructed doesn't get a sufficient load actually.
So,
yeah. So is there already a regulation in place actually at the local level or at the country level also, which ensures that, okay, this should be done like this? If not, what can happen? That's for the entire value chain I'm asking.
Thank you for the question. Yes, there are regulations at the local level, regulations in the Act, but the Act also gives the privilege to the municipalities to develop their own bylaws and regulations if they require, just very similar to India. So we have seen Purosabhas develop those bylaws and regulations for themselves, customized for their Purosabha, and apply those. For example, Kushtia, Jhinaida, I think so, but they developed regulations. And with the IMIS system, it becomes easy to kind of monitor some of these. So they have the authority to do it. What we are advocating through this project, that all the Purosabhas develop their own regulations, and like connection to the drain and septic tank, proper construction of septic tank. These should also be in the regulation. They have all the authority to do it. What DPHE is going to help them is create a template for that regulation, that this is how a regulation looks like, and you adopt it to your local context. This is how a contract looks like with the VACUTAG operator. We're giving you a generic contract. Now you apply to your case, so that you, these things are coming. And the CWISE FSM support cell along with DPHE, they are kind of advocating some of these. Okay. So no more questions. Thank you very much.
Thank you very much, Dr. Tanvir, for your nice presentation and also question and answer session from the audience. Now we will have a panel discussion, and we would like to invite our panelists to join the session here. First, I would like to request Claire Grisafi, Global Program Advisor, WSUP, Dr. Lucy Stevens, Head of Urban Resilience Practical Action, Mr. Rajiv Munankami, Global Coordinator, Sustainable Urban Water Cycles, SNV, Dr. Arumugam Kalimuthu, Executive Director, WASH Institute and President, NFSSMA, India. And also we request Dr. Tanvir Ahmed, Professor BUET and Director ITN BUET, to moderate the session. Thank you.
Thank you very much. This time I'll try not to speak. So first of all, yeah, okay, thank you. First of all, distinguished panelists, thanks for being here and contributing to this session. Hopefully, we'll have a good discussion on this. So we have with us Claire Gisafi. You're a researcher in urban sanitation, Cranfield Water Science Institute, and Global Program Advisor of WSUP. Now, you have been doing research in the role of regulation and improving FSM service provision and quality. And this kind of follows up from the question that I was trying to answer, is that how do you see the role of regulators improving the effectiveness of FSM investments? And maybe you can answer it better than me.
I definitely can't answer it better than you, I'm afraid. Sorry about that. But I will try to at least add a little bit. And I guess, oh, is this on? Yeah, I just need to be a bit closer, I think. And I guess I would say first that I think often, maybe not the group here, but very often more widely, we have quite a reductive view of regulators as basically being the people that set the rules and set the tariffs and then enforce them. But if you look at kind of like established good practice given up by the World Bank and by others, they provide a much wider view of the role of the regulator. And there are three areas which I think are really relevant for the effectiveness of FSM investment. Now, most of these reflect the issues that have already been discussed by Mr. Uttam and Dr. Tanvir. I think firstly, like improving the performance of service providers. And we've seen this certainly so with WSUP. We've worked a lot with national regulator NOWASCO in Zambia, working with them to improve the capacity of service providers, both in terms of financial sustainability and the quality of the service. And obviously that includes marketing, and that includes being able to actually, to expand their markets, to fully utilize fecal sewage treatment plants, for example. And the second one is about pro-poor regulation. So regulating for scale, not just for service quality. So in Kenya with WSREB, WSUP has supported the national regulator to establish indicators, pro-poor indicators, which is for the first time requires utilities to report on low-income areas, to report on the coverage of low-income areas. And so again, it's really incentivizing scale, which again maximizes the use of that FSM investment. And then thirdly, the pivotal role, which Chandrabal talked about on Tuesday, about how regulators are able to influence up as well as influencing down. So influencing how investment is allocated, particularly in terms of investment into soft systems.
Thank you very much. And how do you think, like, in a country like Bangladesh, where the situation that we have, as you see, that we have people discharging fecal sludge directly in the, and sometimes the Vakutag operators are not abiding by the rules. How do you think that where we have very weak regulation, although it's written somewhere in the document or the act or whatever that you have to maintain maintain these systems in a proper way, but it's not being done there. Mm-hmm. In this kind of environment, how do you see these regulations taking shape?
Yeah, really good question. So I think based on some of the research that I've been doing, again, mostly in East and Southern Africa, it's really moving that focus from enforcement to voluntary compliance. And so changing how you regulate, so taking a much more responsive approach to regulation. And I know just do a quick plug for the WHO roadmap for regulating sanitation. That also covers some of those areas in which you have the regulation in place, but how do you translate that into action? So at the national scale, that's already detailed really, really nice and clearly, and it's great guidance, and I would not be able to duplicate that here. I guess the only thing I would add from our experience is the importance, and linking to also what you talked about, the importance of engaging also at the city level. So you have this huge overarching roadmap for regulating sanitation, but that's not a linear process. And in parallel to that, it's also really important to start working at local levels and then influencing up again to try and influence how national regulation is being developed in terms of the implementation. So with WSUP, we found either working at the city level with utilities and working out approaches that build voluntary compliance, or if that's not possible with that capacity, then kind of going down to associations and looking at, okay, with associations, how could co and self-regulation work, and then using that to try and inform national programs. So I guess that local level intervention, they're trying to link it back up to the national level.
Thank you, Claire. And I think I think you're the regulation expert here. At some point, we'll seek your services on how to do this better in Bangladesh. So I'm going to touch on the sustainability issue again. So Rajiv, he's here. He's a global coordinator of sustainable urban water cycles at SNV Netherlands. Although I mean, he's worked a lot of time in Bangladesh, and we worked with municipal authorities at the very early stages of FSM adoption that I mentioned. He's now in Zambia, but there's been you've observed mixed experience working with municipalities, and some were successful, some where you were able to motivate, some not that much. How do you think that the municipalities can be made more accountable for sustaining sanitation services in the long term, based on your experience?
Thank you, Tanvir. First, it's really good to see the growth of the sector in Bangladesh within a decade, starting from 2 towns. Now we are talking about 175 towns. So on one side, really happy, feels like, okay, I mean, seems like we have done a good job. That's why the sector. But on the other side, I mean, a little bit fear and worry as well, like whether the sector can sustain this. Is it like the timing wise? And we are also aware of what is happening and happened in a neighboring country, India, with the national initiatives under the leadership of the Prime Minister himself. Yeah, in Bangladesh, let's say when we started, people used to laugh. Well, I mean, when we went to municipalities to discuss about we want to work on FSM, why do you need to work on this shit? I mean, the country is already kind of ODF, it's all done. Done deal. I mean, why do we need to do this? Then as Tanvir has presented, there were these 14 treatment plans. So all the 14 treatment plans also had their own story. I will share one story. So we took one city, we thought that, okay, that treatment, that particular city we will take and we will try to build on a system rather than those treatment plant was constructed by someone, handed over to municipality saying that it's your job now. And none of the municipality member even entered into that treatment plant for a single day, and never a drop of fecal sludge was in that treatment plant. So we went there, we kind of did the evaluation of the treatment plant, and it was only the drying bed for the solid liquid separation. There was nothing on the liquid treatment. Then we sat with the technical colleagues and said, okay, let's design, let's also have the full treatment. Then with the municipality engineers, planners, we sat with them. We had like 1 year, almost 2 years, we discussed with them and we designed, we constructed the, let's say, affluent treatment part and all, with an assumption that the first part, the drying bed part, it's okay. But somehow we felt, oh, no, I mean, let's see what is inside there. Because from outside, it looks perfect. But when we started taking out the filter media, there were no perforated pipes. So, I mean, from outside, when you go and see, it's perfect. Like, I mean, all the dimensions are there outside, but when it goes down to the details, so, I mean, it's basically why I'm sharing this experience. Like, I mean, he asks about accountability. So accountability is more like taking the responsibility of any decision or actions you take, right? So in that case, what we also see is like, we say that the local authority are not capable. They are very poorly qualified people. I don't think they are poorly qualified. They are our colleagues. We went to same school. So we work, it's just an exposure they have. Like, I mean, they have 100 things they have to do in a day. And I've been working on fecal sludge 24 hours a day. So that exposure, the exposure what I have and the exposure they have, and the local resources, limited resources, and the political environment they work in. So if we can fix the resources and the local politics within the Paurasabha, I think we can make a lot of difference. Now, again, I'll share one more example. In one city, when we selected that city, there was certain government. But after 1 year, the government changed. And it was a completely, I mean, central government was different and the city where we worked was different. It was a city of 1.5 million population. We never got single support from the central government. I don't know if I should say that here, but that was the reality because the mayor was from a completely different. So we had to wait for another election cycle. So these type of, when we started a program, we thought that, okay, this urban sanitation fecal sludge is very complex. We knew that it's going to be a complex. And we thought that it's, okay, it may be 100 pieces puzzle. But when we started working in there, so many issues started unfolding it. And till today, I mean, we have not found that like 2-3 pieces in order to solve those puzzles. So I think first we need to acknowledge that they are capable people. How do we kind of give them more exposure? That is one part. And another is like in terms of resources, because most of the Paurasabhas, they work in a very resource constrained situation. So if we can mobilize resources and develop their capacity, as you have shown, I mean, in Bangladesh, as sufficient rules, regulation, everything is there. So it's more like how do we implement, enforce that with the capable human resource with adequate resources. I think Paurasabha will be, they know, like, I mean, they have to serve the community and they will be accountable. Thank you.
Thank you. And I'm also want to put Rajiv in the spot because he has the most experience in among all the people here. How can you design, I mean, if the municipality wants to design a good business model or service and business model, because we've seen a variety of that. And which one would work, which one would not work? What sort of factors play into those? Because you've been involved in developing some of those models.
I think, I mean, the political leadership, local leadership knows everything. It just matter like how do you involve them. And in essence, we generally, the one approach we follow is called informed choice decision-making process. So in the informed choice decision-making process, we invest a lot in terms of gathering evidences. First, like, I mean, in terms of understanding what is already there, where do they want to go, what additional information are required. So we gather in different, let's say, different people who should be directly involved in the operation across the sanitation value chain. So in some of the countries, Ministry of Health are involved, in some of the country, local government division, in some of the country, let's say, public health department is involved, depending upon the local context. So we develop a technical group. I mean, the city will develop a technical group and they should spearhead all this discussion and decision. What technology they want. First, like, I mean, as a city, what do they want to do with fecal sludge management? Like we've seen a city in Indonesia, they're saying, okay, if someone comes and takes this all out, fine. I mean, we don't need any money, just take it out.
Okay.
So I think it all depends upon the local leadership, but if we involve everyone in an informed decision and with a lot of evidences, and I think if we facilitate that process, the local people are capable of deciding what they actually want and how they want to do it. So maybe a facilitating role from the expert could support them, but in terms of final decision, it should be their decision.
Okay, so the point that I got is like the local leadership and the local stakeholder engagement is important for developing some of these business models. And what they want to see the fecal sludge management system going on in their municipality. So the officials and the local leaders, they should decide among them.
No, I think we should not just let them decide. We should provide them with sufficient information
Exactly.
and evidences.
Exactly,
Good.
because we now have the at least 5-6
Yeah,
good
more.
examples.
Yeah.
So they can pick and choose from them. Now that brings us to Dr. Lucy Stevens. She's the head of Urban Resilience Practical Action, and basically following up from what Rajiv mentioned, that if sufficient demand is not created, you might see FSTPs there, but no fecal sludge coming to the FSTPs. As we've seen in Shokipur, Faridpur, only 25% of their capacity is being used. Now, have we as a development sector not invested enough to achieve this behavior change in municipalities and communities as well that would drive this FSM demand upward? That's the question.
Yeah, thanks very much. And I'm really glad that we're going to be able to say something about behavior change, because it's very important. It's a key part of it. And I think in some of the slides that we've seen so far, that there was a mention of it, but I think it probably deserves a little bit more of a spotlight, because how can we have, a situation where this worrying situation, which is in some ways, like Rajiv said, is really good, that there's going to be this much greater capacity, but we don't want that money to be wasted and the capacity not to be used. And you can't, what's the point of building something and then no sludge is even reaching the plant? So I think there's a few things to say about behavior change. It definitely does require an investment, and it definitely needs to be something that can be done as well, not by an NGO. And I think it's often spearheaded by an NGO, but because behavior change needs to be an ongoing process, and you need to continue with that. We need to find ways that the local stakeholders, community mobilizers, and the municipalities are able to run with some of these things. So I think, so we have had between us in the FSM network a lot of different experiences with and examples of how to do behavior change, and to make this actually quite fun. We've had things like all kind of different initiatives, from sort of courtyard sessions and bicycle rallies and a treasure hunt kind of idea. Importantly, leadership engagement, getting the local leadership to kind of make a pledge that they're going to use these the fecal sludge treatment services. And all of that does require some kind of budget allocation, which can be included in the funding allocations, but will also over time need to be part of what municipalities are spending money on. And I think the good thing about it is we're trying to make it a positive thing, to start trying to emphasize the positives of not, this is a really big health risk, but to say, if you can do this, your neighborhood will be cleaner, your neighborhood will be moving forwards into the future in a really positive way, right? So trying to emphasize the positives in your behavior change messaging. So I think but I think what we've found is that you reach a certain point and then you reach a plateau, right? Because a lot of the municipalities that we've worked in collectively have really reached a certain point, and I think there are particular audiences we have not reached with our behavior change campaign so far. In particular, the people who have septic tanks who are connecting them illegally to the drains, because it's really hard for them to sort of say, well, why should I? Why should I? And this is very quietly around the back of my house. No one's going to see, no one minds. I can just say publicly, yes, but actually I'm not going to do anything about this. So I think that is a different audience that we've not tackled very well, and we need to do more. That's where things like the FSM network come in, where we can share our experiences. And it's a real good function of the FSM network to be able to have these joint discussions.
Thank you, Lucy. And also, so that's a very important point. We haven't been able to reach that part of the segment of the customers that are really relevant. And but we also have another follow-up question, which is also very important. You see that from the discussion, we have seen that entrepreneurs are a big part of this system, and the development of the entrepreneurs is absolutely crucial to have a city which has just installed an FSTP to run. So what can the municipality do actually to develop these entrepreneurs from ground zero?
Yeah, I think it's a really important question, and especially as we're going to this kind of level of scale, right? Because there's 329 municipalities in the whole of Bangladesh. At the moment, we have only a fraction of those, not even 100 of those that have FSTPs. So there's going to need to be some that kind of entrepreneurial system. Now, in the past, the municipalities have taken the responsibility for running those trucks and doing the emptying, but we realized that that has actually been working often in parallel with informal pit emptiers who've been doing a manual emptying job as well. There's been this parallel system going on. Municipalities have been putting a lot of money, spending a lot of money on their emptying services, and they've not been recovering their costs. So in fact, they've kind of been subsidizing a service which is not reaching very many people, but we need to increase that service. So the approach that people are thinking is a good way now is to say, look, let's as well work with those people who are already there in the informal sector, so they can reach more people in a better way, in a way which means that they are not manually emptying, that they have access to the equipment. We've heard of this leasing model, so there's equipment and they can lease the equipment, and that is meaning that sludge is reaching the plant. So you have the sustainability of the plant, and you can have a we have a transformational model, which helps to create the cooperatives and build the capacity for people who already know this business, right? They know this business, they know their customers, they can reach their customers, but they need a transformational model. That is not the only way, though, that you can do this. There's also scope for other kind of enterprises that can start up in these neighborhoods. And I think probably there's space for all, because there are some areas of towns which cannot be reached by bigger trucks and will always need to be reached by smaller vehicles, and that customers will have a preference for different types of service also, and maybe even different payment models, and that we need to make sure we don't just go away with the things that are already there, but help to build them up at the same time.
Thank you, Lucy. I just need to remind you that the audience definitely has a chance to ask questions to the panelists if they so desire. So if you want to ask the panelists something, be prepared with your questions after this first round. We have with us Dr. Kalimuthu here. He's the Executive Director of WASH Institute and the President of National FSSM Alliance in India. So I think we can take a lot of inspiration from the Indian government, at least in this FSM activities here. The Indian government has made sanitation a priority, as we all know, and we see a significant progress in various sanitation-related indicators in India as a result of these initiatives at the national level. So what are the reasons for success, you think, and what inspiration can Bangladesh take from this to improve the FSM services in the long term? Because what you already saw what we are actually thinking about and what sort of investments are now. What should we do actually?
Yeah, thank you, and good afternoon. India's sanitation journey, success stories known everywhere now. And maybe to give a little bit background, the sanitation coverage, actually toilet coverage in the year 1981, it was just 1%, right? 2014, the sanitation coverage across the country, India population 1.4 billion people, right? Sanitation coverage was only 30%, right? So whereas 2014, Honorable Prime Minister Modi announced, the importance of sanitation, right? Within 5 years, right? 2019, October 2nd, we declared country as ODF. Yeah. open defecation free country. Like, so what happened within that 5 years? How come, it is what magic, happened there? Like, so really, so the major point, the success point, the criteria of your list, the political will. The higher, the topmost person spoke about sanitation. The Prime Minister never hesitated to speak about the importance of sanitation. Then followed by what happened. So immediately he spoke the importance we need to achieve 100% sanitation. After that, the policy guideline came out, and they've set up a dedicated mission. That mission called Swachh Bharat Mission, SBM-1. So mainly the focusing on individual household toilet. So, and after that, it's not only a mission setup, then financial assistance. And then it becomes, so the focus is not only with the hardware provision, and equally the importance given for software activities, right? Training, capacity building, and awareness creations. Then it become a people movement. That's what Jan Andolan, we say that it become a people movements. That all resulted, finally, we achieved sanitation coverage by October 2nd, 150th birthday of Mahatma Gandhi. Then October 2nd, we declare country as open defecation free. Yeah, here and there you hear a story that maybe some blocks are left out, but always maybe when such a 1.4 billion people you have constructed, it's a massive achievement. Even 95, 98%, or even 90%, that's a big achievement, right? So that's what that happened. So the major part is the political will. And after that, immediately after that, they've dedicated the policy guidelines, then mission setup, then maybe dedicated funding, huge funding allocated. Then the concentration was integrated. It is not only hardware. What you are mentioning about hardware, then it's not, you construct toilet, no one is using it, there is no point, right? That's what the importance given for creating awareness and sensitization. So everyone came forward and worked together. That was the reason. So not only that, the government realized, okay, 2019, we are going to announce job. Then maybe most of the cases people gone for septic tank based or maybe the pit based. Definitely the pit going to fill. Yeah, septic tank going to fill. What is going to happen? Definitely we need to have a follow-up action. The government by 2019, before declaring itself, the next guidelines was ready. SBM 2.0 launched. Okay. So that is the focus was that fecal sludge and septage management was a major focus, right? Once the pit is full, it should be emptied. The septic tank should be emptied, it should be transported safely, disposed safely. These are the the critical point for success mantra in India. So that's the one, maybe the political will all across.
So we need to replicate that kind of massive movement. So from the audience, anyone wants to ask any of our distinguished panelists? The one over there.
Thank you so much for insightful discussion. I'm curious from different panelists, starting from experience from India, how everything comes from top political will, policy support. So in my opinion, India got the fundamentals right, the enabling environmental right, and then demand driven, and then the supply coming in later. Compared to SNV experience in different countries, did SNV or other organization also invested in this enabling environment, get the fundamentals right from the political support policy and also the community demand driven on the supply before doing more the technical and engineering support? And how does this sequence of support happening to ensure that when something is ready, something else can be done? And based on your experience, is it feasible to replicate India's experience in the cities you are working in? Thank you.
You want to answer? Take this question. Oh, okay, I'll take another question. Yeah, please.
No, my question is about, you said that, India did an excellent job. Then my question is about, different vulnerable population groups. For example, people who are living in urban informal settlements. are they, benefiting the same kind of, services from the government, and also whether that, the sanitation coverage has been achieved 100% in the urban informal settlements and also in the, geographically vulnerable areas? Yes.
Okay, so I'll let Rajiv answer first, then Dr. Kalimud.
Yeah, I think as a development partner, SNV, when we work, we support the local authority in order to develop the model. So, it's the approach we use is like sustainable urban water cycle approach, where we look into the entire service chain and the finance and the enabling environment. So these are all interlinked. There's no logic in terms of you do A, then B, then C. So you have to do A, then D, then E, again come back. So it's kind of interlinked among different components. But the components we have is one is the heavy governance component. That's where we do the institutional legal analysis and also stakeholder analysis to understand who is responsible for doing this particular activity. And we start developing their capacity in order to perform that duty. So we support them to do that. So from the governance, then similarly for demand creation, we have the BCC component. For the services, we have the services component in order to strengthen the services. But unless and until we fix the governance component in terms of supporting local authority in order to develop their capacity for steering and monitoring the sector, no matter how good stakeholder service provider you bring in, they can ruin that service with one signature. So, unless and until they realize, but I don't think we are saying that in Bangladesh, the prime minister, let's say now in the new government, the advisor will have to announce that we have to work in emphasis on sanitation at this moment. Because now the main worry at this moment, we know our people and we know our local authority as well. So looking at 1.5 billion investment and the way, let's say from the FSM network, the amount of energy, effort, resources we have invested in order to prepare the city to be ready for the services, it takes in some cities, not less than 3 years. But all these investment would have different packages. Packages A, 17 city FSTP construction, and it will be tendered out. There are TA components, but it just what we are a little bit worried is how these will be implemented. But I'm not saying that DPHE has realized. They are also cautious in terms of developing a capacity. But sometimes what we have seen is in the construction package, we have a 3-year operation and maintenance. But only including by 3 years operation and maintenance package doesn't ensure the sustainable operation of that treatment plant, unless and until the local authorities or the service duty bearers are involved and they own the entire system. This is not going to function.
Thank you, Dr. Kalimutu. That will be the last. I think we are almost nearing the end. And
Yeah.
Please.
So the focus was maximum 99 or 100% you try to go for individual household toilet. That was the target. Urban slum or rural remote and any part. Wherever the people are finding it difficult they don't have enough space to construct individual toilet, there the government went for a community toilet. So that's and also maybe apart from that, the government of India come up with a protocol, ODF open defecation free protocol, ODF open defecation free plus protocol, plus protocol. Meaning what? The ODF protocol ensuring that each and everyone access to toilet, they are using toilet. The second protocol is about all the public toilet and community toilet, whether it is clean, neat, and maybe meeting the demand. That is another protocol. Third one is whether fecal sludge management, the value chain is maintained, managed properly. All these things they put together, then develop the indicator. The national level survey you might have heard about Swachh Sarvekshan, globally one of the largest survey. Every year, 4,500 towns participate in the survey. Nearly millions of people give feedback on that survey. There they assess, they create sort of competition. Which city is number one, which city is number two, like. There are three ways of scoring. One is about the citizen feedback is the 30% mark for that. Then maybe the city can report back for the what are the work they have carried out for 40 marks. Then the direct assessment from the external facilitator. That's how the city get ranked. And the ranking announced every year. It created sort of competition, like, so that's what so no one left behind. That was the focus behind. So yeah, it ensured that everyone access to toilet.
Okay, thank you. And I think, are there any other questions? I mean, I'll take just, okay, so yeah, good. So, so thank you all the 4 distinguished panelists for being here and giving your time. I think it's been a long 4 days of conference, but I'd like to thank you all. Thank you very much.
We have not yet finished. We have some another small presentation. At the beginning, we shared with you that we are doing this side event on behalf of FSM Network in Bangladesh. So this is the advocacy network. So now Uttamda will share with us what we are doing in this FSM network within a very short time.
Okay, so now let's talk about the FSM network. So maybe, yeah. This FSM network is basically a common and collective platform for the basically 2 purposes. What is the knowledge management, who are doing what and what are the learnings, and to basically collectively advocacy with the government. So this is our members. So initially we started with 5 organizations, but now altogether it is now 19 organizations, and we are expecting few other organizations will also join. So this is our members, and you see that a number of female colleagues are also in the leading position for the who are actually leading the FSM now. Yeah. So this is actually vision and mission. Mission is about the knowledge and advocacy platform, and the vision is that how we can support for achieving their target for the 6.2. This is our approach. If you can see that this is the policy document, and this is here the target, and these are the stakeholders. So basically FSM network connect every stakeholder to make sure that the policies, programs, and practices for leaving no one behind. So that is the FSM network's activities. And this is not a new organization. So Rajiv was saying that 10 years back when it started, we did not, the journey was not like that. So the FSM network actually started 2016, and initially we were focused on event based, but now we are moving to a strategy based. Yeah, we still have we have now clear change agenda that what the network actually working for. So the sanitation workers, decent work, dignifying lives, institutionalization of the citywide inclusive approach, alternative sanitation financing mechanism, that the drive for the private sector engagement, and also the fecal sludge management is standardization and regulation. So these are the change agenda. And we do have some regular activities, like we organize the annual convention, MTS convention, we organize the policy dialogue. We also participate in different FSM international platform, also learning event. So these are, we now also have an action plan for this network. So these are some photos of the FSM convention. This was on the last convention this year. This is the 6th FSM convention, and we made it a regional convention. Participants from India and Nepal, they are also there. So we have some achievements, like during the COVID, we strongly advocated with the government to consider the sanitation worker as a priority customers to get the vaccine, and they did that. Now as we have the policy change agenda, we have started forming the thematic working groups. Currently 2 thematic working groups are working on priority basis 2 change agenda. One for the sanitation workers' lives and livelihood improvement, and the another on citywide inclusive sanitation. So this thematic group and other members are closely working for the sanitation workers. And already we are also arranging dialogue between the sanitation workers platform and the policymakers. So in the last couple of years, we found that few achievements. So the government of Bangladesh already included the sanitation worker in the list of their hazardous job by the Ministry of Labor. And because of this inclusion, now the sanitation worker will have the better access to labor welfare fund. And now the government is also particularly developing a social welfare policy for the sanitation workers. There are also risks involved with this profession. So Insurance Development Regulatory Authority have already developed a committee for developing micro-insurance program for the sanitation workers. And of course, COIs is included into the different development project. That is also achievement. With this network have also a web page. You can visit this web page. And we also started collaboration with the regional collaboration with the India, Bangladesh, and Nepal. And now if you talk about the new direction of this network, we all realize that SDG is not too far. So we need to design the acceleration program for so the FSM network will, in the coming days, will call for the sanitation accelerators. That's all about, in a nutshell, about the FSM network. Yeah.
Thank you very much, everyone. We are just we will now wrap up. So we have got a lot of valuable insight from our discussion today, and if we consider our topic, it is really important that infrastructure is important, but soft components including both enforcement and incentive approach, working with communities, sanitation workers, local municipalities to improve service outcome, and service sustainability is really important. And we have talked a lot about capacity building of local municipalities, local communities, and also sanitation worker is really important for a successful FSM management system. And we talked a lot about inclusive, citywide inclusive sanitation framework. And in that framework, it is really important that how we ensure equity, safety, and sustainability. So these are the major key point we discussed. And finally, we talked about a people's movement, political willingness, and also adequate resources for effective FSM services. So we thank you all for giving us time today, and we hope that you will have some takeaways from this session, and it will be helpful for your own program and own work. Thank you very much for joining us.